and knows that her teeth are hindering her chances of finding love.
Welcome to part 3 of this mini-series here that I'm doing. Can Sarah's teeth be saved? Well, let's find out at her dental visit.
Self-confessed sugar addict Sarah Hilton's teeth are crumbling away.
Alright, that's Sarah's teeth, guys. Probably the best out of the 4 people that we've seen in this video and this mini-series so far. But then again, like I said, I don't know because I don't have x-rays. There's information missing.
If you have a rotten tooth, then it just needs a little filling. If you leave it, it will get bigger and bigger until eventually you might need to have a root canal treatment, a crown, or even extraction.
What do you do after a root canal and it still fails, or that the teeth is beyond a root canal, right? Once the filling gets too big, you do a onlay or maybe an inlay. Once that gets too big, then you do a crown. When you can't do really an effective crown anymore, or when decay gets even worse, I mean, a root canal, that's the 4th. And then after that, it's essentially extraction. So yeah, the longer you wait to treat your cavities, the worse it gets. And guess what? The worse it gets, the more pricey it gets. So it's best to just treat. Also because your teeth are your teeth. They're the ones that feel the best.
The biggest moral of the whole story is get to your dentist really regularly.
Very, very nervous. I've got a headache and I'm very nervous. And I'm tired because I didn't sleep because I was worrying last night, so.
Okay, so if you have a look at the screen, we're going to have a little look around your mouth with the camera. So if you open wide when you're ready.
So she's using CAD cam. Probably
Really
taking
bad
photos.
teeth on the side here, gone very, very deep, and I think you're probably going to need to have a root canal treatment on that. You need to consider taking that one out, but we'll talk about that once we've seen the x-rays, okay? We've got decay on the tips of those teeth, and then a huge amount of decay on that really bad one, that really bad big one there that you can see even better now. So when you get a lot of decay at the front of your mouth, then that kind of implies that it's something you're drinking, so something that's swishing over your teeth, going right to the front. When you get decay on your back teeth, it implies that it's something that you're possibly chewing that's causing the problem. So I think really we've got a bit of both going on there. PR6 is missing.
One pass of the camera reveals the extent of the sugar damage. Things aren't looking pretty. Andrea estimates Sarah's teeth need over £15,000 worth of work.
$19,000. Gosh, dang, dude. Your boy ain't rich right now. I ain't rich. I'm a broke dental student.
10 crowns that need doing, including these 2 at the bottom here, 2 extractions, including those 2 at the top there, and 9 fillings that need doing. Most 20-year-olds around the country, maybe every time they go to the dentist, they may need 1 filling doing maybe once a year or something like that on average. Sarah, on the other hand, she's got huge amounts of treatment to do.
I had a feeling, told you. My prognosis or my treatment planning in my brain that I kind of did in episode 1, I was thinking crowns is most likely what's going to be happening here. Because veneers ain't really a solution for people with caries, especially to this extent. It's just not recommended.
Before she will even consider starting treatment, she needs Sarah to make a serious commitment. First, she wants Sarah to completely overhaul her diet.
If she fails to, stay cooperative with the procedure that the dentist is recommending, change the diet plan, sure, we can fix the crowns, we can do all that good stuff. But if that continues, sugar's still going to be a problem, cavity's still going to be a problem. But now she has less real tooth structure. It's only going to make it worse because at that point, then she'll probably need a root canal, redo a crown. So it only gets worse and more expensive.
How would you feel about looking into reducing the amount of sugar that you're having?
Definitely cut down, try and stop. Obviously, I'll go for it.
She's also got to clean up her act and get busy with the toothbrush.
Really good scrubbing, and I want scrubbing on the top of your teeth and then scrubbing on the inside of your teeth.
I never really clean the inside. So.
Always clean the inside. And then on your lower teeth, pretend these...
You're only cleaning half the teeth. Light pressure is good, guys, on your teeth, but you don't want to be pressing it super intensely. If your hand is getting strained, if your bristles on your toothbrush are getting smushed, here's an image. You don't want that. You're brushing too hard. You're actually causing damage to your teeth by doing that. So light pressure. Also, the other highly recommend is a soft bristle toothbrush. Don't get the hard ones. Don't get the mediums. Those are dental. They hurt your gums. They're not beneficial. They can wear down your enamel on your teeth. Use the soft bristles.
Scary. It was like, I don't know, horror. Yeah, it should be in a horror film.
There is no evidence of grinding, really, because the teeth aren't meeting. What happened to your teeth, Gemma?
I had an eating disorder, bulimia nervosa, for about 10 years. So
Okay, so it's not grinding. I remember my guess was grinding possibility, or it was vomiting essentially, so it causing erosion. So in this case, it is erosion through vomiting, essentially. She has an eating disorder.
The tooth wear is very accelerated. The dentin is so exposed, the enamel is so exposed. The amount of tooth loss is almost that of a 100-year-old patient.
Because the older we get, the more tooth wear we're going to have over time. Also, the enamel layer gets thinner and thinner over time. So yeah, her teeth do definitely look older, right?
The usual procedure is to attach veneers to the healthy tooth. These are undetectable layers of porcelain, custom made and glued over the surface of the teeth. But he's presented with a unique challenge.
Her treatment is going to be difficult because the amount of tooth that's been left on these front few teeth is very little. We're going to get a little bit of tooth space by doing a little bit of laser contouring, and that's going to generate a little bit more height as well.
If Rahul can create enough tooth surface, the plan will then be to attach the porcelain veneers.
You know, watching this is actually teaching me how to do treatment planning for the future. So that's interesting. He's gonna have to do a laser gingivectomy, where he actually gets rid of some of the gums on top of the teeth, makes the teeth look a little bit longer. Not look, actually extends the teeth and shows more teeth structure. Hopefully a better bonding for the veneers is what he's thinking.
Constant toothache means that eating meals is a painstaking process.
If I can get away with not chewing it, I'll just swallow it.
One slip of the fork and she's in agony.
See, that's painful, bro.
50 miles away in Gloucester, dentist Neil Taylor has built his reputation on his ability to treat the most phobic of patients. He thinks he understands why fear of the dentist can exert such a powerful hold.
Some people don't like dentists or anyone else invading their personal space. So, because the dentist does get intimately close to you, you wouldn't let most people, that close to you.
Sarah's making the effort to brush her teeth properly, employing the methods Andrea taught her at the surgery.
Positive change. I love to see it. She's brushing the inside, the lingual side of her teeth, the palatal on the top. That's very nice. I love to see the change.
Sarah has a particular reason for wanting to succeed.
Aesthetics.
She's been single for over a year and knows that her teeth are hindering her chances of finding love.
Love. That's what we all want at the end of the day, right?
to the guy and he said to me, by the state of your teeth, I'd be worried about what the rest of you is like.
Grab a little bit more tooth height. And the way we're going to do that is by actually using a laser to just take away a small amount of gum.
This is a gingivectomy, increasing or showing more of that tooth structure by pushing back or getting rid of some of that gum layer. We'll save this for the part 4. So I'll see you in the next episode of the series. Subscribe, turn on bell notifications so you guys don't miss out. I'll see you guys on the next video. And don't forget, stay smiling.